last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond. Hello, South Florida and beyond, and welcome to the You and Your Doctor show for Tuesday, July 28th, 2020. I'm glad to be with you. We're here with Dr. Alan Patterson, MD. He's an OB-GYN specialist and infertility specialist located in Coral Springs. Dr. Patterson, how are you doing this evening?
I'm doing great. Thank you. How are you doing? Good?
Doing great. Can't complain. I can hear you loud and clear. You look great. So let's get right into it and tell everyone about the, OB-GYN and infertility care that, you practice. So telemedicine's a big thing right now, and you've been doing telemedicine for quite some time. Tell us some of the conditions, women can be seen for via telemedicine.
Sure. My practice is set up to treat certain gynecology conditions by telemedicine. Eventually, we may be doing some obstetrics, but yet that takes specialized equipment. But many gynecology conditions can be treated with telemedicine, such as vaginal discharge, pelvic pain, birth control questions, hormone therapy, yeast infections, STD questions. There's a number of things that I can treat. Urinary tract infections are easy to do. There's a number of things that we can do with a telemed visit to save the patient a visit into the office because it's done from their convenience of their home or work. And the way we do it is we have them download a free app, no cost to them on their cell phone, and then it's billed to their insurance. Almost every major insurance is covering telehealth. And if they're self-pay, we give a low self-pay price so somebody can do it with self-pay, so it works very well.
Yeah, that's great. And there's a long list of the services. I mean, pretty much named all of them, but at obgynpatterson.com, you'll hear me give Dr. Patterson's website out a lot. One of the best websites around for, medical news. There is a ton of information on there. Again, it's obgynpatterson.com, or his number is 954-613-0070. Yeah, so a lot's changed with telehealth and telemedicine. Insurance is carrying it with this COVID-19 pandemic. It seems like definitely there's a lot of different changes, but that's great that I know you were way ahead of this in offering it. So that's great to offer to your patients. I want to also follow up with you about, a lot of different people aren't, maybe going into the doctor's office or maybe, still a little bit, hesitant to. But why is it important for women especially to still keep up with their, well woman's visit and annual exam?
Well, obviously that's very important because when you go for your annual exam, it's preventative. And if you have a problem or issue, we discuss it then. So that could lead to other visits to diagnose an undiagnosed problem. So while many visits can be done by telehealth, your annual exam, we need for you to come in because we do a pap smear and or cultures depending on what your age is, and a breast exam and the pelvic exam, and check your vitals and that sort of thing. And sometimes we end up drawing blood at that visit, or we will schedule another visit such as an ultrasound or something else if you're having a problem. So it's important for you to take care of your health, and every doctor's office I know is doing everything they can to prevent the virus, which we can get into that in a second. But it's extremely important not to neglect your health. If you're a few months late, that's fine, because every insurance still pays for you to have an annual exam, and there's no copay to you. So that's the one exam that we can do in gynecology that is paid for by your insurance.
That's great news as well. And again, it's OB-GYN Patterson.com, 954-613-0070. Dr. Patterson, since you mentioned it.
There's actually two numbers. That's the number to book online, but my main number of my office is 954-755-9311. That gets you directly to the office. The number you said is the number to book online. So there's actually two numbers, but if you want to call directly, it's 954-755-9311.
Okay, thank you. I just jotted that down. Since you mentioned kind of a little bit about office, let's skip ahead and talk a little bit about, safety protocols in place at the office if someone has to come into the office for an office visit or a well woman's visit.
Sure. Most offices I know are doing good safety protocols, such as my office. All our patients must wear a mask. Myself and my staff are wearing a mask. You must come alone because we want to limit the amount of people in the office. And we are cleaning the office after each patient. And I wear gloves the whole time when I'm talking to somebody. When I walk in the room, I'll put gloves on, even if I'm not going to examine them. And I wear my mask all the time. And we ask our patients to wear their mask all the time, because the virus can be spread asymptomatically. We're trying to space out visits so there aren't too many people in the office at one time. And my office staff do a great job of cleaning the office. They're cleaning it 1 million times a day. And we will take your temperature to make sure you're afebrile. So we're trying to do everything we can to keep my patients safe, to keep myself safe, and to keep my staff safe. And so is every other doctor's office, because nobody wants to get the virus.
And it's a beautiful office, very well decorated in Coral Springs at 7451 Wiles Road, Suite 205, Coral Springs, Florida, 33067. All that info is on OB-GYN Patterson.com. We have a couple minutes before the first commercial break. So I wanted to ask you also, since we were talking about, well women's visit and annual exam, also about a mammogram and breast ultrasound. Can you tell us a little bit about those services that you offer? Because I know you're a mammogram and breast ultrasound specialist as well.
Well, I don't read the films, but I encourage people we do breast exams in the office, and I encourage my people to get their annual mammograms when they're of age. And myself and 12 other doctors are opening a brand new mammogram and ultrasound center in East Boca Raton. It's going to open August 3rd. The latest and best mammogram and ultrasound equipment. You book the appointment through my office. If we're on the insurance, the mammogram place is on the insurance. It's going to be small, gorgeous, very private, no more than 2 patients in there at a time. So much safer regarding the virus, because some of the other centers, they may have a lot of people in there doing mammograms and other x-ray things. This is just for mammogram and ultrasound. So we're excited that we can offer our patients this service that's going to be opening August 3rd, and it's going to be the best, greatest, newest, and most expensive equipment. So we're going to be state of the art, and it's going to be a gorgeous place and very clean and sterile and very personalized, and get you in and out. We respect your time and your privacy, and we want you to feel totally safe and comfortable, because it's very important to get a mammogram. And if you need an ultrasound, it can be done at the same time.
That's great. We got the scoop on that news. Yeah, August 3rd is it's less than 5 days away. That's great news.
Next week.
We're
excited. It's been a long time coming, and we did it the right way. So it's a perfect time for it to open. with this virus going on, and we control it. So all the other inequities that we see at the other mammogram centers, we're trying to cut that out of ours because the doctors will be controlling it. We have the best radiologists reading the film, so it's going to be good all the way around.
And should they call the appointment line prospective patients for that, or
schedule a mammogram, you want to call our office. You cannot book that online. You have to call our office right now, and we book it for you, and we tell you the time and the date. And if you need to change it, you can call our office and we will change it. And the nice thing is that we will have you sign a records release, so we will get your records over to the mammogram place. You don't have to go pick up your films like in the past when people changed mammogram centers. They'd have to go to the old center, ask for their films, have them put it on a disc, takes a couple of days, and take it to the new center. With our thing, where you'll sign a records release, and we do that for you. So we are trying to make it as convenient as possible for our patients, because once again, we value your time, and it's important if you were going somewhere else to have your old film, so we'll be able to compare it to an old film, so that'll be the best care that you can get.
That's great news. Well, again, the website's OB-GYN Patterson.com. Dr. Patterson, we've already talked a little bit about telehealth and, well woman's visit and mammogram and breast ultrasound. We're going to take a quick commercial break, but stay right there. On the other side, we're going to talk about menopause, pelvic floor therapy, and the OB care that Dr. Patterson provides on the You and Your Doctor show.
Sounds great.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. It's the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor show. We have Dr. Alan Patterson here, MD. He's an OB-GYN and infertility specialist located in Coral Springs at 7451 Wiles Road, Suite 205. His number is 954-755-9311 or obgynpatterson.com. We learned he offers telemedicine, telehealth, whichever way you want to phrase it. Well woman's visit, annual exam, mammogram and breast ultrasound as well, and opening of a new mammogram and ultrasound, office in East Boca Raton. Great news. So you can, check with his office on any future info on that. Dr. Patterson, you cover a lot of areas of interest, so let's get back into it. Going back into the conditions you treat, how do you provide treatment for menopause?
Well, many people have problems with menopause, and it happens to many women. The main symptom when people start going through menopause oftentimes is they have bad hot flashes where they feel hot all the time, and this can happen more at nighttime, so it can interrupt the sleep. So for menopause, there's many herbal things you can try for the hot flashes, and I offer a good herbal therapy from a company, Shift MD, that you can only get through the doctor's office. That works. I find it's the best herbal product that you can use, in my opinion. But if the herbal product doesn't work, or you don't want to use a herbal product, then there's menopausal hormonal therapy that if you don't have any contraindications, the benefits far outweigh the risks. And if you talk to anybody that has hot flashes, it can make you miserable. So to get on hormonal therapy, this can get rid of the hot flashes. And there is one medication that's a non-hormone. So if the hormones are contraindicated, there's a non-hormonal medication. So the patients have lots of options. So the point is, if you're having problems with this, there's no need to suffer, because some people may not. Everybody's variable. Some people may never have hot flashes. Some people can have hot flashes for a few months, but some people can have hot flashes for years. So it can be irritable. It can ruin your sleep. It can ruin your day. It can sweat out good clothes. So there's no reason to suffer. So you talk to your doctor about it, and based on your specific needs, there's lots of different hormone therapy. If you don't want to go with the herbal, or you can try the herbal first. If it doesn't work, then you've proven to yourself that you tried that you need the next step. So it's a good thing for women to see their doctor, and it can lead to other symptoms also that we can get into later besides the hot flashes. So the benefits of therapy far outweigh the risks, and it's all about quality of life. People are living longer. There's no reason for you not to enjoy yourself, that the things you used to do when you were younger, and your ovaries stopped making the hormones, so you have to replace the hormones that your ovaries used to make, so you can enjoy yourself in your 60s, 70s, 80s, 90s, up to 100.
That's great. A lot of options for treatment. Dr. Patterson offers it all. That's great for quality of life. And, I like how you mentioned, the variable, because, every case is different. And that's why we have great doctors on this show, so the community can connect with them and find out, what kind of treatment options are available, or how they can, better their quality of life. Another one of your areas of interest is in pelvic floor dysfunction. Talk a little bit about that and how you can help women with that ailment.
Yes, a lot of women you can even get in your 30s, sometimes in your 20s, but 40s, 50s, and 60s can have weakening of the pelvic floor muscles. That's oftentimes a result of pushing out children during childbirth, and that leads to weakening of the tissues as women age. So when those tissues weaken, it can lead to loss of urine when you cough and sneeze, or urgency issues where you can't get to the bathroom fast enough, or vaginal laxity where the vagina isn't tight anymore, or problems with flatus and stool. So pelvic floor therapy is done in my office, where it's like physical therapy for the vaginal pelvic floor muscles. So it's a machine that teaches you how to do your Kegels, and it also has a TENS unit to strengthen those muscles. So when you have this problem, sometimes it can be treated with medicine, sometimes you need surgery, but this is that natural physical therapy that's in between those two. So if somebody wants to be natural, it's physical therapy that you come once a week, or you can come every other week. We run your benefits, and most major insurances cover it. If you don't have a deductible, often it's a copay, and every single patient of mine that has done it has got improvement, some much more than others, but every patient has got improvement, and it's helped them. And then they have homework to do at home to continue to do the pelvic floor exercises to strengthen that, and they know how to do them better. And then the insurance covers so many visits per year, and when that's out, the following year we can rerun your benefits and you can continue to do it. So this is a great natural, non-medicine, non-surgery way to treat these problems that many women can have. And once again, it's about quality of life. There's no reason to suffer with these problems if there's something you can do about it, because when you're in your 40s, 50s, and 60s, people are busy. They don't want to have these problems, and I don't blame them. So this is a great way to treat and sometimes cure these problems, but make them much better and livable, so you don't have to use medicine or resort to having surgery, especially at a time like this. If you don't want to go in the hospital, even though the hospitals are doing everything they can to keep everybody safe, because I do deliver at 2 fine hospitals, and they're doing extraordinary precautions to do a great job of keeping everybody safe during this virus time.
Well, we got about 3 more minutes. Let's talk a little bit about that OB care that you provide, obstetrics, the full spectrum. We're going 360 here. So which hospitals are you on staff at where you deliver babies?
I'm on staff at West Boca Medical Center and Boca Raton Regional Hospital, 2 very good hospitals in Boca Raton who have great labor and delivery units and are doing everything possible to keep everybody safe from the virus. Because I have to do deliveries at both hospitals. That's where I deliver at. I just did one Sunday. I just did one today. I think I have 7 people scheduled for either C-sections or inductions in the next 2 weeks. So it's very busy for me, but our hospitals are doing everything they can to keep everybody safe, and the patient and her husband can come. Some hospitals in other states are not letting the husbands come, which is too bad. But and they test everybody for COVID. So we know if you have COVID or not. And if somebody does, then the proper precautions are taken. So I can't stress enough that the hospitals are very safe. The labor rooms I deliver at are excellent. They give excellent care. They have excellent nursing, excellent people running them, and excellent doctors like myself and other doctors delivering there to give patients the very best care that they can get in these trying times.
Well, there's a ton of info at OB-GYN-Patterson.com. We only got about another minute, I believe. So you can find info on prenatal care there, pregnancy care, talk to Dr. Patterson as well and find out, even what kind of, delivery method you'd prefer as well. Let's talk this last minute about fertility treatments. You also offer those as well?
I do basic infertility work up to a certain point. So we encourage people to come in and I can start the workup, and then I will refer to a good reproductive endocrinologist if that's a problem that I fix, because it's important for people to get the best care possible and get pregnant as soon as possible. And when I refer them to the reproductive endocrinologist, I want them to get pregnant, because then they refer them back to me for OB care. So we want the patients pregnant. I want to deliver them, and it's a good situation. We have very good treatment in South Florida.
Well, I want to thank you again. You're the leader in the clubhouse for interviews with me in 5 years of doing this. I think this is our 7th interview. So thank you again for joining me.
Radio show host.
I appreciate it. Thank you, Dr. Patterson. Again, it's OB-GYN-Patterson.com. The number is 954-755-9311. He's located in Coral Springs. Look him up. He treats, OB-GYN and infertility. We'll see you next time on the You and Your Doctor show.
Thank you.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinion